Hi, my name is Sarah Hill, and today I'm going to tell you all about prostate cancer. Prostate cancer originates in the prostate gland. Since males are the only ones that have a prostate gland, this particular cancer only occurs in men. The prostate gland is located inferior or just below the urinary bladder. The tube that is seen passing through the prostate gland in the image to the right is the urethra. The picture shows what a normal prostate gland looks like, and then illustrates what a cancerous tumor could look like within the gland. In its early stages, prostate cancer may not cause any symptoms other than a burning sensation when urinating. However, late and more advanced stages of prostate cancer are typically more symptomatic. Patients report trouble urinating, erectile dysfunction, weakened or decreased pressure in the urine stream, pelvic region pain, and even bone pain. Blood in semen is also an issue for patients with progressive prostate cancer due to the function of the prostate gland. Here's a more detailed diagram. The prostate gland, along with the vas deferens, produce fluid that encapsulate and protect sperm. These fluids make up semen and are ejaculated together with sperm and out of the body. We know that cancer cells are abnormal cells with mutated DNA. We also know that these cells divide and multiply very rapidly. These cancer cells accumulate and form tumors. Tumors can then break off and migrate to other areas of the body. The breaking off is referred to as metastasizing of the cells. This is cancer, and it can affect whichever organ or region that the cells spread to. Cancer is diagnosed and named based off of the cell's location within the body. With that information, we know that prostate cancer and the involved cells are located in the prostate gland, and that is how it is named. Skin cancer is the most common type of cancer for men, with prostate cancer being the second. Around 1 man in every pool of 9 will be diagnosed with prostate cancer during their lifetime. Again, females do not have a prostate gland and therefore cannot develop prostate cancer. Men are the only gender demographic at risk. As far as aging, your risk of prostate cancer increases as you age, and it is less common for men who are under 40 years old to develop it. It is proven that African American males are at greater risk for prostate cancer than men of any other race. This is unexplained as far as we know. For African Americans, it is also said to be more likely to be an aggressive cancer. If prostate cancer has been present in your family, then your risk may be increased. Or even if your family has a history of breast cancer, and it was indicated a very strong breast cancer, your risk for prostate cancer could be also increased. Another thing is obesity. Obesity seems to cause lots of issues and seems to make everything worse in terms of health. Obese patients with prostate cancer could be presented with a more advanced or aggressive cancer overall. According to the American Cancer Society, in just the first half of 2020 alone, there have been approximately 191,930 brand new cases of prostate cancer. Also, just in this year alone, there have already been 33,330 deaths caused by prostate cancer. As far as diagnosis concerns, a blood test can detect something called prostate-specific antigen, or PSA, which is a protein made by the prostate gland. Elevated levels of PSA could indicate prostate cancer, or it is just a revelation of an enlarged prostate, which may or may not be involved with prostate cancer. After the blood test, your provider will probably perform a digital rectal exam with a lubricated finger to feel for cancerous nodules. To rule and diagnose cancer, a biopsy must be performed. A transracial ultrasound usually comes hand in hand with the biopsy so that the needle can be placed correctly. Proper technique regards a needle being inserted into the prostate through the rectum, and tissues are then extracted for testing. The treatments for prostate cancer are vastly based on how severe or aggressive the case is. Low-risk patients are often put on active surveillance or observation. This means that exams are done frequently in the duration determined by your provider of around 1 to 3 months to continue to check if the cancer is at bay or if it is actually getting worse. Usually symptoms at this stage are little to none. Another method of treatment would be to surgically remove the prostate and the immediate surrounding tissues should the cancer be contained to the prostate gland only. This can be done in either of the two methods shown in the picture on the right. Removing the prostate gland comes with some serious side effects. Patients can experience incontinence, erectile dysfunction, changes in dryness associated with semen due to fluid missing from the prostate that is no longer there, fertility complications since the vas deferens will be cut in surgery and sperm cannot be moved outside of the body. This is much like a vasectomy procedure that men can opt to have. You still produce sperm. However, with your vas deferens being severed, your sperm have no way to travel out of the body. Lymphedema could also occur due to removal of the lymph nodes around the prostate. An increased risk for hernia is also a problem. Chemotherapy is a popular treatment for all cancers and involves taking an anti-cancer drug that travels through the bloodstream and kills cells. Notice how I did not say cancer cells because all cells are affected. The side effects of chemo can include hair loss, nausea, vomiting, fatigue, easy bruising or bleeding, loss of appetite, and much more. Chemo is very taxing on your body. Radiation therapy involves rays of high energy that kill cancer cells. The rays can be external or internal, and they come from a machine. Some effects include bowel issues like diarrhea or actual leakage, urination problems, erection problems, fatigue, and again lymphedema due to damaged lymph nodes from radiation. Hormone therapy takes a different approach to treatment. It works by surpassing the hormone responsible for the stimulating cancer cells to grow, which are androgens like testosterone. This is often used to shrink worsening cancer in order to make other treatments more effective. Typical hormone side effects are possible, like low sexual desire, hot flashes, fatigue, and weight gain. Immunotherapy is when drugs are administered to a patient with the expectation that their own immune system will then recognize and destroy cancer cells double time. Side effects are similar to other treatments. Targeted therapy is like chemo, but is designed to prevent damage to normal cells. In chemo, like I said, all cells take a large hit, and that is what makes patients who undergo chemotherapy so sick. Targeted therapy drugs change the way cancer cells act in regards to the way that they divide, grow, or repair themselves. Side effects are similar to those of chemo, but typically are less taxing. And finally, cryotherapy is less common, but involves a procedure that uses very cold temperatures to freeze and kill cancer cells, as well as a large portion of the actual prostate gland itself. Very cold gases are administered through needles into the prostate, and patients are monitored by ultrasound throughout the procedure. Side effects of this treatment include erectile dysfunction due to decreased nerve endings from damage during freezing, and urinary incontinence. For all cancers, the earlier the cancer is detected, diagnosed, and treated, the better off the patient will be. Prostate cancer is actually pretty low risk in terms of all cancers when in the early to mid stages. Once you hit stage 4 prostate cancer, it probably means that your cancer has metastasized and spread to somewhere else, and this is when most fatalities occur. Even with treatment, cancer can come back. There is no 100% cure for any type of cancer. It is hard to say how long patients have if they choose not to treat their prostate cancer, as it could spread in 5 years or 5 months to a more severe form. Spreading can happen anywhere throughout the body or organs, but most commonly prostate cancer will spread to your lymph nodes around your prostate gland, which will spread throughout the lymphatic system and to the rest of the body. For my presentation, I used Hopkins Medicine and their Journal for Prostate Cancer Prognosis. The American Cancer Society sheet was a really good resource, and I also found some diagrams from the Mayo Clinic site. Thank you.